K-12s, welcome back to my front room or my study for another health lesson. We are looking at chapter 6, so Australia's healthcare system. So there's 4 key areas of Australia's healthcare system that we need to be aware of. We've got Medicare, which most people are somewhat familiar with. We've got the Pharmaceutical Benefits Scheme, which looks at providing medication, also known as the PBS. We have private health insurance. Sometimes I get lazy and I write it as PHI. And lastly, we've got the National Disability Insurance Scheme, which is commonly referred to as the NDIS. So they're the 4 areas that we need to know in a little bit of depth. So we need to know what kind of services these areas of the healthcare system provide, who they're looking after in particular, and specifically we're going to look at some stats or some numbers about how these areas are funded by the government or supported by payments from taxpayers. So let's have a little bit of a look at the first one, which is Medicare. So you can see here that I've noted that it's Australia's universal health insurance scheme. So when we're thinking about insurance, we're thinking about looking after people with regards to their health, should they have any issues. It also provides, and you'll see I've underlined this, free or subsidised medical treatment for all Australians. So if you are a permanent Australian resident, you are covered by Medicare. You'll also find that with Medicare there are reciprocal rights with some countries. If I think about New Zealand or the UK, there are some countries that we have an agreement with, so we'll look after their citizens, knowing that if something happened to me and I was in New Zealand, I could get looked after under Medicare there within some limitations, but still, I'm just looking after countries that we've got a good relationship with. The other thing I might flag, if I come over here, is the difference between services being free or subsidised. So you might have ever wondered when you go to the doctor what it means if a service is bulk billed or not bulk billed, and maybe sometimes you've paid, sometimes you haven't paid. So under Medicare, one of the key services that's provided for Australians is being able to see a doctor. Yeah, and it's an essential service that you can have access to a GP. So what the government does is it sets a scheduling fee. So currently the price that the government has set to see a doctor is $37.60. So that's sort of what they set, that's what they've worked out is the cost per person to see a doctor. So if your doctor agrees to that scheduling fee or follows that recommendation, those services or that visit to the doctor is actually free. So you go in, see your doctor, get whatever it is you need sorted, and then you leave and the doctor might say that's been bulk billed. So that's all covered. If you go to a clinic and maybe the doctor is charging outside of that scheduling fee, so outside of that $37.60, you'll actually find that you'll need to pay a part or a co-payment. So say your doctor charges $60, you might be out of pocket initially, that's $60, and then you might find that you get direct debited or you might get a payment back from Medicare of that $37.60. So you've paid some and then the government have paid some. That's what it means when we talk about subsidy or something subsidised. So it's at a lesser expense or a cheaper price. Very quickly, if we just think about some things that are and aren't covered by Medicare, I've obviously mentioned GP as an essential service, treatment in a public hospital, anything to do with diagnostics for a condition. So if you think about pathology or blood work, any x-rays that you need to diagnose a condition, Medicare will cover that. Things that aren't covered by Medicare, dental is a big one. There's a little loophole for children aged 2 to 17 for really essential dental services, but generally speaking, dental's not covered. Very, very expensive, so please look after your teeth. Hopefully you're brushing, flossing. You've got plenty of time in ISO to tend to those pearly whites. What else was I saying before I was talking about good dental hygiene? Ambulance, not covered. Also something that can be really expensive if you don't have ambulance cover. Cosmetic surgeries, not covered. And allied health, so if you think about physios, chiropractors, podiatry, generally not covered by Medicare unless you've been specifically referred by your GP, and then they can set up sort of a care program where you can get some visits through Medicare, but generally not. So pretty much we've looked at who Medicare is for, that's everyone. We've talked about what is and isn't covered. Now we need to look, and I might move over, at how Medicare is funded. So there's 3 ways that Medicare is funded, and I've written them here for you, but I'll just explain. The first one is the Medicare levy. So the government sets a levy, and at the minute it's at 2% of taxable income that all goes towards supporting and funding Medicare. There's a little bit of an exception if you are a very low income earner. The government can't take an additional 2% of tax. Look, they're just not earning enough. But for most people, every time they receive a paycheck, they might see that a portion has been taken out for tax. 2% of that is going straight to Medicare. You need to know these figures as well. Definitely going to ask you about these in your SAG. Really important that you know how stuff is funded. Number 2 is the Medicare levy surcharge. So this is for high income earners. So we're looking at an additional 1 to 1.5% tax for those high income earners who aren't taking out private health insurance. So it's sort of saying if you can afford to pay your way, if you can afford to take out your own insurance policy, why should you be taking essential services away from those most in need? So we're just sort of thinking about not bogging down Medicare or the public system. So if you can pay, they're kind of like, off you go get your private health insurance so you can alleviate some of the pressure off the government system. So that's income tested. And look, it's pretty much if you're an individual and you're earning over 90K, or if you're a family earning over 180K, you classify as a high income earner and you get an additional tax. So they're hoping people are like, oh, don't want an additional tax, probably just going to take out private health insurance. That way I only get taxed 2% like everyone else. The last one, pretty general, given the name, general taxation. Look, if there's money left over that the government can use towards Medicare, in order to keep that 2% stable, money's taken. So look, a fair bit of money, even I look at my paycheck, a fair bit goes towards taxation, so they can take additional means from there. Just something to think about. That Medicare levy at 2%, when I first started teaching health, it would have been 2016, that was originally at 1.5%, so it's only recently gone up to 2%. And part of me wonders, given that we've got a lot of people who aren't working in this current climate, a lot of people have been made redundant, lost their jobs, which is awful, and Australia's not being particularly productive, but we've got a massive reliance on the healthcare system and those healthcare workers. Part of me wonders if this will go up post-COVID-19. So just something to think about. Look, obviously we aim to keep that as low as possible, but yeah, potentially. So you can be like, Miss Ryan told me that she thinks the Medicare levy will go up. There is my prediction. So I've added in these little things to think about. Just make sure when you're going through your textbook that you're adding in extra detail to your notes. You need to know what Medicare covers, what it doesn't cover. So I've already spoken through a couple of those examples. The other thing you need to think about is this term here called the Medicare safety net. You need to know what this is. It's very important in terms of making Medicare equitable, so helping out those in need. So what we've got is a safety net. So if a person or a family in a 12-month calendar year goes over a threshold, so maybe they've got a chronic condition or they've been in a really serious accident, had an extensive rehab program, the government actually reduces the cost of healthcare for them if they've gone over it for the remainder of the year, just to look after those people most in need. So please have a look, make sure you add into your notes, Medicare safety net. Alright, cool. Hopefully we're feeling good about Medicare. Let's come on over. Things got a little bit squashed, and I also, you might have noticed, I couldn't fit in the NDIS, so I'm going to have to pause this video, make this disappear, and then start again. That's fine. I needed you guys to be like, why don't you space things a little bit better and not take up half the board with Medicare? Anyway, I've gone too far. So let's look at the PBS. So a reminder, the Pharmaceutical Benefits Scheme. So that's looking at subsidising essential medications for Australians. So a couple of keywords, those medicines must be essential. So we're looking at medicines that have high efficacy. So that means that they've been well tested, well researched, and that they're essential. So they're prescribed for common conditions that affect most Australians. That word again, subsidy or subsidised. So we're looking at providing those medications at a reduced cost. And you'll see here, patients actually make a co-payment. So the government covers a little bit, not all of the medication, and then the patient pays the remainder. There's also, if you're a pensioner or a concession card holder, you get more subsidisation on your medications. I guess if you think about older people, they generally need more medications as they get more comorbidities, so more health issues. I think about my nan, and she's got one of those, you know, those like pill packets that old people have with the Monday, Tuesday, Wednesday. So as you can imagine, as you get older, your reliance on this becomes greater. So they're trying to look after those older people and pension holders. Similar to Medicare, there's something to think about is actually the PBS safety net. So it's pretty much the same principle that we just spoke about, but we're looking at someone that's had a big reliance on medication in a 12-month calendar year, and then for the remainder of that year, the government will subsidise medication at a cheaper cost for them. So very much an equity thing, making sure that everyone can afford to access the essential medications that they need. Cool, last one for this board before we do the switch is private health insurance. So this is a type of medical insurance and it's taken out in addition to Medicare. So very much like a policy that you would have for your car, your parents might have home and contents insurance for the house. You are looking at paying a premium, so it could be monthly or yearly, depending how your bills are set up, for a policy that you select. So we might talk a little bit more about this point in a minute. Look, pretty much these systems, government and private sectors, need to work together. And the reason being, private health insurance actually provide funding for the healthcare system. So some of that money from premiums and money raised within the private sector actually gets put back in to build hospitals and recruit health professionals, pay healthcare workers. So it's a really important balance between this public and private sectors. The other reason it's so important that I mentioned before is it actually alleviates pressure off the public system. If you imagine we had everyone relying solely on Medicare, think of the wait lists. It would be backlogged, staff would be overworked, it'd be a really big issue. So they're hoping that they can push some of those high income earners, those people that can afford to pay their way, and that will alleviate the stress. Because of this, the government provides 3 incentives. So 3 is kind of the magic number. Remember, we had 3 ways that Medicare was funded. Now we've got 3 incentives that the government is providing to encourage people to take out private health insurance. So number 1 is lifetime health cover. And look, I will stress this, if you're not confident in describing this in an assessment or a SAC, don't go there. People tend to get really mixed up, and I'll show you why. Lifetime health cover is pretty much an additional fee. So if you're over the age of 35 and you don't have private health insurance, but then you decide to take it up, the government will actually charge you an additional 2% loading fee through your private health insurance premiums for every year that you were over 30. So you can see how people get mixed up. They get the numbers confused. They get muddled when they talk about lifetime health cover. So make sure you're all over this. So once you get to 31, the government's almost given you a little grace period. They've been like, oh, you've turned 30, but maybe you're still a bit confused and you haven't worked out lifetime health cover. But once you hit 31, and then you think, oh, I really should have taken out private health insurance. I'm getting older. Maybe I want to start a family. They're like, well, where were you a year ago? We're actually going to charge you 2% more for that year that you missed out from the age of 30 till you catch up. So if someone was 40 and decided to take out private health insurance, they'd be paying an additional 20% until they caught up on their premiums. And look, you might be saying, oh God, that's not fair. But I guess what they're trying to do is push people into private health insurance sooner rather than later. And also in fairness, so I've had private health insurance since I was 25. Obviously I play a lot of sport, and my parents really encouraged me to take it out in case I did an ACL playing netball. Obviously turned out pretty handy last year when I had my hip done. But I guess why should I be paying premiums from the age of 25 and then someone could get to the age of 50 and be like, oh, actually starting to have some arterial disease and my diabetes is out of control, maybe I'll take up private health insurance. So it's sort of in fairness as well. So yeah, just be aware of that 2% loading fee. There's lots of ads on the TV about this too when people are looking at their health insurance bills. Anyway, I've talked enough about lifetime health cover. Medicare levy surcharge, we've already spoken about this with regards to Medicare. Again, that additional 1 to 1.5% tax. It's the same thing for Medicare, how it's funded, but I guess you could classify it as a private health insurance incentive because no one wants to be taxed more for not taking out private health insurance. And the last one is private health insurance rebate. So the government thinks, hey, good job for taking out private health insurance. We're going to help you out. So those monthly premiums or that yearly premium that you pay to take out private health insurance, we're going to pay a percentage of it. And it's up to 30%. So I think I looked before, I get 26% back from the government. So whatever my premium would be, I get 26% off. And that's to help me out. You know, I'm not driving around a Ferrari. So they figure that I need a little bit of encouragement to take out private health insurance, which I appreciate. So yeah, up to 30% rebate. Few things to think about, and this is kind of where I wanted to come back with what I mentioned about the selected policy. You need to have a think about what private health insurance actually provides and offers to its members. So private health insurance is very much a choice, and you get to select your provider. Think about Medibank, HBF, Bupa. I'm trying to think of some other ones off the top of my head, but I've kind of run out. Any one of those insurance companies, and then you get to pick your policy. So you can select from a basic hospital cover. So a reminder that Medicare will actually cover 75% of those fees in a private hospital. But you've got to keep in mind that there's, I guess, a significant gap that you still need to pay. And the other thing that you can do with your private health insurance policies is you can actually opt for additional extras. So some of you might have, through your families, it might include a couple of physio visits a year, maybe 2 visits to the dentist, maybe if you wear glasses, that's included in your coverage for your private health insurance. So I can't stress enough, if you haven't already put me in fast forward and muted me, don't do that. Please chat to your parents about this. Look, you've got no one else to talk to in ISO. So make use of your family dinner time. Ask your parents firstly, do you have private health insurance? Why? Why not? And then also ask them, if you do, I guess what made them take out their policy and what it includes. Because you might find that you've got certain extras or certain coverage depending on what policy you've got. It's kind of like a car insurance policy. You might have different excess, different things that you need to pay if you make a claim. So yeah, please have a chat to them about this. It is really useful stuff. I know, look, I find it interesting, but hopefully you're not too bored. This will become important. And I tell you this because at the age of 25, you actually get kicked off your parents' private health insurance policy. So for those of you that are on PHI at the minute, 25 comes up a lot faster than you think. I was living my best life at uni, and then all of a sudden mum was like, oh, you're no longer on the private health insurance, better sign you up. By the way, it's really expensive. So it is very much a personal choice. For me, like I said about my hip and playing sport, I chose it because I wanted to pick my doctor. It's another advantage of private health insurance. I was very fortunate that I could pick one of the best surgeons for hips through Ortho Sports Victoria. And the other thing is there's no waiting lists. So if I had have gone through the public system, because I was still somewhat mobile and it wasn't an urgent surgery, I could have been waiting for years. I know a mate that waited a year after she did her ACL at netball, and it was a pretty long wait for her. She just couldn't get in through the system. It wasn't actually that bad, but she had to wait it out. So no waiting list. You get to pick your doctor, pick your hospital. Look, there are out-of-pocket costs, but that's something for you to weigh up and something for you to think about. All right, I might pause it. I might make this a two-part video in case you need a breather. And then I'm going to be back later to talk about the National Disability Insurance Scheme because I ran out of room on the whiteboard. Alrighty guys, thank you. I'll see you soon.